This is a presentation on the blood supply of brain and spinal cord. And let's begin with the spinal cord. And we're going to look at the arterial supply of the spinal cord. Now the main supply of the spinal cord comes from the vertebral artery, which also takes part in the supply of the brain. And then we also have the vertebral artery being supplemented by branches from arteries which lie in the region of the vertebral column, and they send feeder branches. Now let's first examine the vertebral artery. And the vertebral artery arises from the subclavian, so it arises in the neck. And because it also participates in the supply of the brain, this has to enter the cranial cavity. So after having arisen in the neck, so this here is the vertebral artery, it travels through the foramen transverse area of the cervical vertebra. It travels through the upper six. It does not travel through the foramen transversarium of the seventh cervical, but it travels through the other six. And then it passes into the foramen magnum by passing over the surface of the first cervical vertebra called the atlas, pierces the dura and arachnoid and enters the subarachnoid space. So here we have the two vertebral arteries which have entered into the cranial cavity, and they give off two branches. Each vertebral artery gives off two branches, an anterior spinal artery, which is this one here, and a posterior spinal artery. The two anterior spinal arteries join up immediately and fuse to form a single anterior spinal artery which lies along the midline in the median fissure. The posterior spinal arteries remain separate, so you have one on either side, and this is the posterior view. And these arteries they lie along the areas where the dorsal roots of the spinal nerves are attached. So that's where you will find these posterior spinal arteries. Now these anterior spinal arteries, because they arise from the vertebral arteries, as they travel down, you can see that the caliber of the vessel will decrease naturally. So in order to maintain the caliber of the vessel and to supply the spinal cord right up to the cauda equina, it is supplemented by branches which come off from the neighboring arteries. So these neighboring arteries send branches by means of the intervertebral foramen. So traveling through the intervertebral foramina, you have these feeder arteries which pass in, and you can see that they are supplementing the anterior spinal artery. Of particular, and also the posterior spinal arteries. Of particular importance is the artery of Adam Kiewicz, which arises around the lower thoracic or upper lumbar region, and this is unilateral, usually arises on the left side, and sometimes it may be the most important blood supply of the spinal cord at this level. So therefore, if this artery is blocked, then the thoracic and lumbar segments of the spinal cord, that area would be damaged. So one is always worried about this artery, or keeps this artery in mind. Let's look further at the arteries and veins, and here what we are looking at is, you can see that this is the anterior spinal artery in the midline, and these are the two posterior spinal arteries. This anterior spinal artery supplies the anterior 2/3 of the spinal cord. So this is on one side, so you can see it supplies this entire anterior 2/3, and that's why it's involved in the anterior spinal artery syndrome. The posterior spinal arteries just supply the posterior 1/3 of the spinal cord, so they supply the area of the dorsal columns. Now here you can see these are the feeder arteries. You can see how they pass in with the spinal cord, with the spinal nerves, and then divide along the anterior and posterior roots to supplement the anterior and posterior spinal arteries. Now the veins follow these arteries and emerge from the intervertebral foramen, but instead of having one anterior spinal vein and two posterior spinal veins, we actually have 6 longitudinal channels, 2 in the midline, and then we have 4 laterally, 2 on the posterior side and 2 on the anterior side. And they form a kind of circle around the spinal cord where they anastomose with each other. They also have communications through the intervertebral foramina with veins present outside, and they communicate with the internal vertebral venous plexus, which is this one, which surrounds the spinal cord, and it lies outside the dura mater in the epidural space. Now the importance of these veins is that the veins outside of the spinal cord, they communicate with these spinal veins and with the internal vertebral venous plexus. And let's look at that further in this image, and here you can see this is the internal vertebral venous plexus, the one on the inside. This is the external vertebral venous plexus on the outside, and these are those segmental veins present at each level. These segmental veins drain various viscera, thoracic viscera, abdominal viscera, pelvic viscera. They also drain the bone marrow of the bone marrow of the vertebral column also drains by means of a vein known as the basivertebral vein, which you can see communicates with the external vertebral venous plexus and the internal vertebral venous plexus, and through these it communicates with the segmental veins. Now because of this interconnection of these vertebral venous plexuses and the segmental veins, carcinoma anywhere in the body can travel, the cancer cells can travel, so from anywhere, let's say that in the pelvic area, the prostate gland, the prostatic venous plexus has communications with the vertebral venous plexus. So you have these cancer cells which may travel like this, pass in here, and since they are communicating with the vertebral venous plexus, some of those cells may go in and enter the vertebral column, where they form secondary deposits. So you often see skeletal secondary deposits in the vertebral column. This can also travel upwards through, by means of this connection, can travel into the brain, and you may have secondary deposits in the skull, or it may even enter the brain and the spinal cord. So usually when a person has carcinoma in the organs and you find secondary deposits in the vertebral column or in the brain or spinal cord, this is how you would explain how the secondaries got there. And that's why it's important to know the venous drainage of the organs, and also know what the communications are. Now let's look at the arterial supply of the brain, and some important facts about the arterial supply of the brain is that while the brain forms only 2% of the body weight, it gets 17% of the cardiac output, and its oxygen utilization is about 20% of the total body's oxygen utilization. If the brain is without oxygen for 10 seconds, unconsciousness results, and you can have permanent brain damage if there is ischemia for more than 10 minutes. So therefore, whenever there is any kind of ischemic heart disease or anything like that, we're always worried that the brain should not lack oxygen or be devoid of blood supply for more than 10 minutes. Another interesting feature about the brain is that there is a auto-regulatory mechanism in the brain, and the cerebral blood flow remains constant despite changes in pressure. And this is if there is a lowered blood pressure, the cerebral vascular resistance also lowers. And if the blood pressure is high, the resistance also increases. And this makes sure that the cerebral blood flow remains constant at all times. Now let's examine the arteries which take part in the arterial supply of the brain. And we have two main arteries, one which we already saw, which is the vertebral artery. So here we have the vertebral artery. And the second one is the internal carotid artery. So here we have the internal carotid artery. So this together, the brain is supplied by what is often called the vertebro-carotid system. Now if you remember, these two vertebral arteries entered into the foramen magnum. They gave off the two anterior spinal arteries which fused to form one, and then they also give off the posterior spinal artery. So let's say that's the posterior spinal arteries. They also help to supply the brain. So what the vertebral arteries do, they give off a branch, a very tortuous branch called the posterior inferior cerebellar artery. And you can see this over here, the posterior inferior cerebellar artery, and you can see how tortuous it is. As the name suggests, it supplies the posterior part of the inferior surface of the cerebellum. And here we are looking at the ventral aspect of the brain. So this is the ventral aspect of the brain, and this is the ventral or inferior aspect of the cerebellum. So this posterior inferior cerebellar artery supplies the posterior and inferior part of the cerebellum. Then the vertebral arteries fuse together at the lower border of the pons to form an artery which is called the basilar artery. So you can see this is the basilar artery which lies over the surface of the pons. This basilar artery gives off various branches. You have many pontine branches which supply the paramedian area of the pons. So this area of the pons is supplied by these pontine branches. It also gives off an important branch called the anterior inferior cerebellar artery, and again, as the name suggests, this is the anterior inferior cerebellar artery. So this artery supplies the anterior and inferior part of the cerebellum. So here we have the posterior inferior cerebellar artery. So the anterior inferior cerebellar artery now supplies the anterior inferior part of the cerebellum. Then the basilar artery gives off another branch called the labyrinthine artery. And this labyrinthine artery is a slender branch, but it enters the internal acoustic meatus. So here you have the internal acoustic meatus somewhere around this region. So it enters the internal acoustic meatus to go and supply the structures forming the labyrinth or the inner ear. Then just before the basilar artery divides into its two terminal branches, you need an artery which has to supply the superior surface of the cerebellum because you've taken care of the inferior surface. So the basilar artery now gives off the superior cerebellar artery. So here we have the superior cerebellar artery which turns this way and goes on to the superior surface of the cerebellum, which will be on the other side. So it supplies the entire superior aspect of the cerebellum. But while these arteries, superior cerebellum, anterior inferior cerebellar and posterior inferior cerebellar, supply the cerebellum, you can see that because of their position they also help to supply the pons, and here they help to supply the medulla oblongata also, which is why you have those various medullary and pontine syndromes. Now let's look at the terminal branches of the basilar artery, and it has two of them, and these are called the two posterior cerebral arteries. So we have the two posterior cerebral arteries on either side, and as you can see here, between the posterior cerebral and the superior cerebellar, you can see a nerve up here, and this is the third cranial nerve. So the third cranial nerve is present somewhere here in between the posterior cerebral and the superior cerebellar artery. And sometimes if these arteries are too close to each other and they are dilated or there's an aneurysm, this third or cranial nerve or oculomotor nerve can be injured, and one has to watch out for that. Now this posterior cerebral artery, as the name suggests, this is the posterior cerebral artery. It travels on the posterior aspect of the cerebral hemisphere and helps to supply the posterior surface the posterior aspect of the inferior surface of the cerebrum, and we'll see it in the next image. So this was the vertebro-basilar part of the blood supply of the brain. Now let's come to the internal carotid. So let's clear that and let's go back to looking at the internal carotid. So we have the internal carotid artery which enters the cranial cavity through the foramen lacerum, travels in the carotid canal, and then pierces the dura and arachnoid and enters close to the optic canal, and there it divides into various branches. Now since it's close to the optic canal, it gives off an artery, the ophthalmic artery. So let's say that that's the ophthalmic artery, which, if you remember, also gives off a branch called the central artery of the retina. Then the internal carotid gives off the posterior communicating artery, which joins with the posterior cerebral. So you get somewhat of a circle being formed over here. Then the internal carotid gives off another branch called the anterior choroidal, which is up here. It's a small branch called the anterior choroidal, which travels down this way, passes backwards to form the choroid plexus also, and as it's passing down, it also gives branches to the internal capsule. And then finally the internal carotid divides into its two terminal branches. the anterior cerebral, which travels up. So it travels up this way, turns around and goes on the superior surface of the corpus callosum, where it lies on the medial aspect of the cerebral hemisphere. So we'll see it on the medial aspect. The two anterior cerebral arteries are very close to each other. So as both of them hook around and travel this way, they go that way. They are very close to each other. They are joined by an artery called the anterior communicating artery. And then the other terminal branch, which is an extremely large branch, is called the middle cerebral artery. And here we have the middle cerebral artery, which passes along the lateral sulcus and comes on to the lateral aspect of the cerebral hemisphere. So here now we can see that you have a complete circle being formed, and this circle is known as the circle of Willis. And you can see from behind you have the two posterior cerebral arteries. Then you have the posterior communicating, internal carotid, middle cerebral, anterior communicating, and back the other way around. Now this circle of Willis is extremely important because if the internal carotid or vertebral artery is blocked, the blood passes forwards or backwards across the point to compensate for the reduction in blood flow. Normally the two blood streams are distinct, so that the bloodstream from the left vertebral artery and the bloodstream from the right vertebral artery follow their own side, and they flow along their own half of the circle of Willis with no mixing. And so we have the right part of the circle of Willis and the left part of circle of Willis. And the mixing occurs only if there is a blockage somewhere along the pathway. Now let's look at these arteries in a little, some of the other arteries in a little more detail. From this circle of Willis and from the anterior cerebral and middle cerebral, you have branches which are called central branches. All of these arteries supply the cortex, but they also send in branches which pierce the cortex. So they'll pierce the cortex. So here we have the cortex. So these arteries send branches into the cortex, and these are known as cortical arteries. But we have branches which are much longer and go down to supply the white matter. These are known as central branches. And some of the central branches are named, and they are called striate arteries. So we have the striate arteries of the anterior cerebral, which are known as the medial striate arteries. And then we have the striate arteries of the middle cerebral, called the lateral striate arteries. And these are particularly important because they supply the internal capsule. And if there's a blockage in any one of these branches, or the artery ruptures, then the internal capsule can be is damaged. And in fact, the commonest source of a cerebral hemorrhage is one of the lateral striate branches of the middle cerebral artery. And this artery has actually been given a name, and it's called the Charcot's artery. It's called the Charcot's artery, spelled Charcot's artery. And this has a very tortuous course. So as this middle cerebral artery is passing like this, it gives off these lateral striate arteries which go in this way deep, and it comes to supply the internal capsule. And as it's supplying the internal capsule, it actually passes through this lentiform nucleus, the putamen of this lentiform nucleus. So in this area, this is where it usually ruptures, and the cause is very often a pre-existing systemic hypertension. The hematoma which is formed may be small or large, and if it's extremely large, it ruptures into the lateral ventricle, and it's fatal in 24 hours. And the typical clinical case is one where the person complains of a sudden severe headache, and this is followed by unconsciousness within a few minutes, and then one must suspect a stroke, and quite often you will find that it has occurred in the internal capsule, and it's because of this lateral striate branches. Now let's look at these cerebral arteries in a little more detail, and we'll go on to the next slide. So here we have the cerebral arteries. So you can see now only the cerebral arteries are shown here. So here we have the posterior cerebral artery, and you can see it's supplying a large portion of the inferior surface of the cerebrum, and in that inferior portion it's supplying the posterior part. And what lies in the posterior part? You have the occipital lobe up here, and occipital lobe is the visual cortex. So the visual cortex is supplied by this posterior cerebral artery. The middle cerebral, if you remember, traveled all the way like this to go on to the supralateral surface. As it passes this way, it gives off, I need to do that over. The middle cerebral artery passes along the lateral sulcus this way and goes on to the lateral surface of the cerebral hemisphere. As it's passing on, you can see it gives branches to the temporal pole, and it gives branches to the lateral part of this frontal area. So you can see this is the area of supply of the middle cerebral artery. The two anterior cerebrals, if you remember, as I mentioned, they go on to the medial surface, and as they are traveling on the medial surface, they supply this medial aspect of the frontal lobe on the inferior surface. So on the inferior surface, this is the area of supply of the cerebral arteries. Let's look at the lateral and the medial surfaces. And here we are looking, up here we are looking at the lateral surface. So this area is the lateral surface, and this part here is the medial surface. On the lateral surface, so here we have the middle cerebral, which comes off from the ventral aspect, and as it travels here, it supplies, you can see, a major portion of the lateral surface of the cerebral hemisphere. So it supplies the frontal, the parietal, the temporal, and a little bit of the occipital area. And this is a wide area of supply by the middle cerebral artery. We had said that the posterior cerebral supplied the visual cortex. The middle cerebral supplies a large part of the motor and sensory areas because they lie in the frontal and the parietal lobes respectively. It supplies the motor speech area, which is present here, the Broca's area. It supplies another area called the Wernicke's area, which is responsible for sensory speech, which is present in the parietal and temporal lobes. And because it supplies the superior and middle temporal gyrus, it also supplies the auditory area and the gustatory area here, which is present in the parietal lobe. So you can see what a lot of important areas the middle cerebral artery is supplying. The anterior cerebral artery supplies a strip of cortex over here right up to a sulcus present here called the parieto-occipital sulcus. And in this area you have the leg and the leg region of the body being represented, because the body is represented in an upside down fashion. So if we represent the body like this, and then we have the knees on the other surface, so the leg area is supplied by the middle cerebral artery. The leg area is supplied by the anterior cerebral artery. Now let's come to the medial surface, and here we can see now we have the anterior cerebral. As you can see, it's going over the superior aspect of the corpus callosum, and as it travels along like this, it's giving off branches. So most of the medial aspect of the brain is supplied by the anterior cerebral, and here we have the knees and feet and the perineal area being represented, and that's the body, because the body is represented, as I said, in an upside down fashion. So this is the area, the leg area, then you have the rest of the lower limb and the perineal area being supplied by the anterior cerebral. This here represents part of the inferior surface. The medial surface is just this much. This represents part of the inferior surface too. So you can see here that the temporal pole is supplied by the middle cerebral, and the occipital cortex here is supplied by the posterior cerebral. So these are the important functional areas too that you must know which artery supplies these areas. Now on the surface, these arteries anastomose with one another. So there is an anastomosis between these various arteries, and if a branch is blocked, then the other artery can take over. But when these arteries send branches, the central branches which go perpendicularly downwards to supply the white matter, these central branches do not anastomose with one another. So if one of those branches is blocked, as is shown here, then that area of the brain is devoid of blood supply, and you get what is called a stroke. And an embolic stroke just means that a small embolus is a piece of a thrombus that has been thrown off, and it's gone and blocked one of those smaller arteries. A stroke is exactly like a heart attack. It's only the name is different. It's a brain attack and it's an ischemic attack. Now in the circle of Willis, in the area where the circle of Willis is present in the interpeduncular fossa, very often you notice certain swellings present, and these swellings are of the arterial wall, or dilatations of the arterial wall are known as berry aneurysms, and you can see in an angiogram how this berry aneurysm shows up. Now these berry aneurysms are responsible for about 10% of strokes, and 10% of strokes are because of rupture of these berry aneurysms. Usually they are about 5 to 10 millimeters in diameter, and in 5% of the population it's a routine autopsy finding. And if a ruptured aneurysm is a prime suspect when a stroke comes out of the blue in someone who's less than 40 years. And usually what happens is that the characteristic presentation is a sudden blinding headache, and then the person collapses and becomes unconscious or even comatose within a few seconds. And then there's a massive rise in intracranial pressure, and this can be fatal within a few hours or days. Recovery may be impeded because by a secondary elevation of intracranial pressure, and this is caused because once the aneurysm ruptures, a blood clot is formed, and then the blood clot obstructs the absorption of CSF. It's usual practice to define the aneurysm by carotid angiography, and that's why I showed you an angiogram over here. And whenever an aneurysm is found, then one ligates it surgically, because without operation most aneurysms will leak again at some future date or so. And it has been noticed that these aneurysms are seen in families. So if somebody in the family has an aneurysm, there's a good likelihood that somebody else in the family may have an aneurysm. Now this is a picture showing you a subarachnoid hemorrhage. And whenever there's a hemorrhage in the brain, we are always worried about a rise in intracranial pressure. And here you can see this is a CT scan, and you can see this area here where you can see this is the hemorrhage, and this hemorrhage you can see is compressing the brain because it's formed a big hematoma and obviously can result in neurological deficit, and so one has to take care of this hemorrhage pretty fast. Let's look at the venous drainage of the brain. One important thing to remember is that all the veins which drain either the cortex or the central core of the brain finally find their way into one or the other venous sinuses. And then the venous sinuses again follow a particular route, and they travel out of the brain and get out through the internal jugular vein. So all the venous drainage finally exits through the internal jugular vein, but it has communications with various vessels. We already saw how there was communication with the internal vertebral venous plexus. You also have communication with the scalp veins. So while these are small communications, the main exit is through venous sinuses which open into the internal jugular vein. Now let's look at these veins in a little more detail. So here we are looking at the lateral surface of the cerebral hemisphere, and from the cortex we have veins which drain the cortex, and these are known as cerebral veins. So we have these which are present above the lateral sulcus, known as all of these are called the superior cerebral veins, and these are called the inferior cerebral veins. They all drain into a sinus which is closest to them. Now if you remember the durameter, you had a superior sagittal sinus which traveled all the way from the front anterior part to the back. So these superior cerebral veins drain into the superior sagittal sinus. In the middle area up here, the veins drain into a vein here which is called the superficial middle cerebral vein, and this goes medially to drain into the cavernous sinus. So the superficial middle cerebral vein drains into the cavernous sinus which is present on the medial aspect. These inferior cerebral veins pass into the nearest sinus which is the transverse sinus. So these are the three sinuses that we are looking at in relation to the lateral aspect of the brain. From the core of the brain, from the white matter, the veins pass out and they form a vein on either side, which is known as the internal cerebral vein. Now these internal cerebral veins join up together and they drain into a vein which is called the great cerebral vein. So we have these two internal cerebral veins, and they from either side they join up together to form the great cerebral veins. And these great cerebral veins also drain part of the internal capsule, which is drained by a vein called the basal vein. So that's why you have these basal veins also opening into the great cerebral vein. Now let's follow these veins in the next image. And here we are looking at the dura mater, and you can, if you remember, between the two layers of dura mater you had the venous sinuses present. Now this is the superior sagittal sinus present here in the at the upper border of the falx cerebri, and this here at the lower border is another sinus called the inferior sagittal sinus. Now this superior sagittal sinus passes along this upper border, turns, and at the internal occipital protuberance this continues as the right transverse sinus. So this superior sagittal sinus turns around and continues as the right transverse sinus, and we'll follow that in a little while. The inferior sagittal sinus up here receives this great cerebral vein. So up here we have the great cerebral vein, joins this inferior sagittal sinus, and the two together form the straight sinus. And this straight sinus is present at the spot where the falx cerebri meets this fold, which is called tentorium cerebelli. So between these two, between the falx cerebri and the tentorium, we have the the straight sinus. Now the straight sinus turns around and becomes the left transverse sinus. So we have the superior sagittal becoming the right transverse sinus, we have the straight sinus becoming the left transverse sinus. This transverse sinus then continues forward and becomes the sigmoid sinus. So the transverse sinus continues forwards to become the sigmoid sinus, and then the sigmoid sinus passes out of the jugular foramen and continues as the internal jugular vein. So you can see how these sinuses have passed out and continued as the internal jugular vein. But if you remember, we also mentioned the cavernous sinus. Now this cavernous sinus is present on the in relation to the interpeduncular fossa close to the pituitary fossa. So you have this cavernous sinus present here, and we remember the superficial middle cerebral vein drained into the cavernous sinus. Now from the cavernous sinus you have two sinuses passing out along the superior border of the petrous temporal bone and along the inferior border, and these are called the petrosal sinuses. So you have the superior petrosal sinus. You can see the superior petrosal sinus comes and drains at the junction where the right transverse becomes the sigmoid. It becomes the sigmoid and travels out this way. So at that junction this petrosal sinus drains into that part. The inferior petrosal sinus drains directly into the internal jugular vein. Now this cavernous sinus, as you can see, it communicates with the cavernous sinus on the other side, and apart from that superficial middle cerebral vein, it also has connections, you can see here, with the ophthalmic vein, and in the face area there's a venous plexus called the pterygoid plexus of vein. So you can see that it has connections with the pterygoid venous plexus. Now if there was some infection which made its way into the cranial cavity and somehow involved the cavernous sinus, then that infection could spread to the eye or it could spread to the face. Usually it's the other way around. Eye infections or facial infections, because of this connection with the cavernous sinus, can travel into the cranial cavity, involve the cavernous sinus and cause a thrombosis over there. So if there is a thrombus formation, that means then the intracranial pressure will rise, because remember the CSF drains into the venous sinuses. So the intracranial pressure rises and that causes a lot of problems. So the communications of this cavernous sinus are extremely important. And let's look at this cavernous sinus in a little more detail. And here we are looking at the cavernous sinus, and you can see the petrosal sinuses more clearly in this picture. So this is the cavernous sinus present, and you have the other cavernous sinus of this side. And this is the superior petrosal sinus, which drains. This here is the superior petrosal sinus, which drains at the junction of where the transverse becomes the sigmoidal. And this is the inferior petrosal sinus, which drains into either the internal jugular or the sigmoid sinus, where it becomes the internal jugular vein. Here you can see this is a straight sinus, and this area here is called the confluence of sinuses, because you have the superior sagittal sinus coming from above, you have the straight sinus coming straight on, then you have the two transverse sinuses which go on either side. So there is a area here where there's a big pool of blood, and that is known as the confluence of sinuses. Now this shows you these two cavernous sinuses, and notice how close they are to the pituitary gland. So again, if there is a problem in the cavernous sinus, the pituitary gland can be affected. And passing through the cavernous sinus are some very important structures. We have the internal carotid artery, which passes through the cavernous sinus. It's separated from the blood of the cavernous sinus by endothelial tissue. And along with this internal carotid artery, we have the abducent nerve, the sixth cranial nerve. And along the lateral wall of the cavernous sinus, we have the third or oculomotor, the trochlear nerve, and then we have the ophthalmic and maxillary divisions of the fifth cranial nerve. So these are some very important structures in relation to the cavernous sinus, and therefore if there is any problem with the cavernous sinus, then these structures could be affected. Now that finishes this presentation, and it's extremely important that you listen to this presentation more than once, so that you can assimilate what has been said, and make sure you take notes. And if you listen to it more than once, when you listen to it the second time, you may have missed something the first time. And if there are any problems, do not hesitate to ask or email me, and I'll make sure that I clarify them.